Turning now to your community focus, November is Diabetes Awareness Month, and it's also often a time when indulgence around the holidays comes to mind. So joining us now to talk about how to keep yourself healthy is Dr. Carla Martin with the Rhode Island Department of Health. Thanks so much for being here.
Thank you.
So as I mentioned, November is Diabetes Awareness Month. How big of an issue is diabetes?
So diabetes is a very serious and very common disease. About 12% of Rhode Islanders report having diabetes.
Wow.
And unfortunately, there are a lot of people with pre-diabetes, which is the stage before you have diabetes. And we think probably around 300,000 Rhode Islanders have pre-diabetes.
Wow.
It's a very common disease, especially as we have an obesity epidemic. As more people become overweight and obese, more people are developing type 2 diabetes specifically.
Yeah, you know, there is the type 1 and type 2. Can you talk us through the difference and which one is more common?
So type 2 diabetes is more common. So what happens with diabetes, your pancreas, which is the organ that produces insulin, which helps you, which helps take the sugar in your blood and put it into your cells so your cells can use it. So in type 1 diabetes, you're either not producing enough insulin or the insulin that you're producing is not being properly used by the cells. So you're still getting high blood sugar levels.
And that typically affects kids, right? Type 1 diabetes?
So type 2 diabetes is usually in adults. Type 1 diabetes often affects, it usually starts in childhood. So in type 1 diabetes, it's an autoimmune disorder where your pancreas is just not able to produce insulin or just produces too little.
And type 2 diabetes can develop later in life?
Yes, it's very common later in life. Unfortunately, we're seeing a lot more young adults and teenagers developing type 2 diabetes because of the disease of obesity and overweight.
Wow. So who is most at risk for type 2 diabetes?
So people who are older, so definitely as you get older, you're more at risk, and people who have the disease of obesity are more at risk as well. If you have a sedentary lifestyle, if you tend to eat a lot of processed foods have just a lot of sugar, a lot of salt, a lot of fat, you're more at risk for having type 2 diabetes.
What are the signs and symptoms?
That's a good question. So some symptoms that you might feel if your blood sugar is high are excessive thirst, excessive urination, excessive hunger, dizziness, blurry vision. Sometimes people get their heart racing or palpitations. So if you have these symptoms, especially if you have a family history of diabetes or if you have overweight or obesity, please see your healthcare professional.
As I mentioned at the top of this segment, it's November, we're approaching the holiday season, and lots of us are going to be gathering with family and friends and having those big holiday meals. What's your advice to people to stay healthy?
Definitely your nutrition. Just be mindful of what you're putting in your body. So really try to focus on a whole food, whole grain, mostly plant-based diet. So half your plate to be vegetables. Really cutting down on processed foods, sugars, sugary beverages, sports drinks, sodas, definitely cut down on that. I mean, everything in moderation around the holidays. Movement, so move your body at least 30 minutes, 5 times a week if possible. Try to get 7 hours of sleep a night, and really trying to be cautious with substances. So trying to cut down on your alcohol, especially if you have diabetes, cutting down on your alcohol and smoking, cutting down on your smoking. If you have diabetes and you smoke, you're at much higher risk of a heart attack.
Very interesting. All right, so some good advice for all year round, but especially during the holiday season. Dr. Carla Martin, thanks for being here.
Thank you.